Good evening, everyone. Welcome to another event, another show of Let's Learn Money. Let's Learn Money. Our show tonight, we have a guest host, Miss Logan. Is supposed to be on the show with us. I don't see her here as yet. But without further ado, I would like to let everyone know that we have a very interesting night tonight, and we're gonna get right into it. We're gonna get right into it. I promise you, it's gonna be a very exciting show. I'm your host, Eugene Bias, coming to you live on this webinar, and we can do a bit of housekeeping, and then we're gonna get right into it. For some reason, I don't see our guests yet. Okay. For some reason, I don't see our guest yet. I'm hoping that she's here. Okay, she tells me she's in the waiting room. She tells me she's in the waiting room, so let's bring her in and start our show.
Fee Services LLC for all of your financial needs. We are a licensed brokerage with years of experience in the financial industry. Let's discuss your financial DNA. Saving for college, planning for your retirement, preparing for milestone birthdays, and significant investments such as house, car, or boat. Call Gene at 855 411 0424. You can also follow him on Facebook, Twitter, and LinkedIn.
Well, I think we're having some technical difficulties because Miss Logan is saying that she's in the back room, and she's backstage, and I'm unable to see her um, on. I don't see her. I'm trying everything. I don't see her. I don't see her backstage. Um, Let me see. Um, at this time, she's not on. But while we get it together, I'll ask you to bear a little patience with me as I work through these issues. I'm not sure why she's not coming in. Um, I'm not sure why she's not coming in. The show is up, it's live, it's ready to go. I don't see anything on my side. Anyway, we're 5 minutes into the show, and we're gonna um we're gonna start our show this evening with a couple of things. I currently don't do health insurance, but that's why I brought a um that may be an issue um that we're trying to work through at this time. Um that's an issue that I'm trying to work through at this time. So if you guys bear with me for 2 seconds, let me see what's going on here, because everyone that's on the group connection. 1 second. Um, we're having some problems here, and I'm not sure I understand what the problem is. And my engineer is unavailable. So let me see if I got one problem fixed. Okay, seems like I got one problem fixed. Here she is. Here she is. Here she is. Here she is. Hi, hi, hi. Hello, hello, hello. Hold on 1 second. Would you unmute your phone?
Yes.
Would, yes, here she is. We
Yes.
got her, everybody. We got her. We got her. We got her. Good evening. Good evening, Miss Logan. How are you?
I'm well. Thanks for asking. How are you?
I'm great. I'm great. I'm great. Thank you for joining our show this evening. We have a pretty packed agenda. Thank you for giving us some of your time. We really appreciate it. I know time is very valuable, especially in this time when the healthcare registration and the healthcare industry is at its peak.
Right.
Um, so tonight's show, our special guest is Miss Cynthia Logan, as I told you guys. We figured it out, we got her on, and we're happy to have her. Miss Logan, tonight on our show, let's talk about money. Let's learn money show. What we try to do, and you have some insight to this, is that we try to educate the community, our community in Radio Land, on Facebook, on Twitter, um, all our connected partners. We connect them so that they can understand how money works, okay, and getting the best value for their money. Okay. So tell us a little bit about yourself. I know you're one of our trusted healthcare insurance provider, and you serve very heavily in the Afro Caribbean diaspora. Um, and you have your own company, and tell us a little bit about yourself, please.
Thank you. Good afternoon, everyone. It's such a pleasure to be with you. Thank you for having me. I am just grateful for the opportunity to join this show tonight and just tell a little bit about myself, what I do, and the purpose for what I do, for why I do it. I am Cynthia Logan, as the host has already said. I am a native of Liberia, so I am African. Hence, is why the focus is with the Afro Caribbean communities. I am a mother, an educator, a mentor, and currently I really enjoy serving in this capacity as an educator, advocate, and a mentor in the healthcare space for my communities. Um, in the past, I worked as an educator. I worked for several decades as that. I worked internationally teaching, and today I serve as I run a youth mentoring organization in Clayton County where I live, and we serve Clayton and South DeKalb communities. And additionally, what I really do is insurance stuff. I talk insurance. I help my community understand health insurance, gain resources and access to everything that can help them live a healthier life through a quality life through a good health, affordable health insurance. So thank you.
Great, 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 great. That's great information. What's the name of your company, please, may I ask?
Yes, my pleasure. The company is the Palava Hut.
The
Can you say
Palava,
it, Eugene?
Palava Hut, of
You
course.
did it. You did it. Awesome.
Of course, of course, of course.
You did.
So,
Huh?
at the Palava Hut, you specialize mostly in the health space, the health
Yes, I do.
insurance space. So you must be very busy right now
Yes,
with open enrollment and all the nice stuff that's going on currently.
you're absolutely correct. I just stepped out of an event just to have be on this show. I just stepped out and I left a line of people waiting to be enrolled. But two of our other agents are there. Yeah.
Nice, nice, nice. So let me ask you a question. Um, so tell us a little bit about what is ACA or Obamacare?
So ACA is the Affordable Care Act that was enacted into 2014. The landmark legislation passed by President Obama, which gives us regular people access to affordable health care. And when I say regular people, I'm speaking in terms of the fact that people who may not have high income enough to go out and get insurance on their own if they're entrepreneurs, or people who work jobs that have higher insurance rates, and when they accept those insurance, it leaves them almost deciding on my mortgage or insurance. What do I do? My kids are eating or insurance. And so the affordable health care is passed to allow individuals and families to use a tax subsidy to acquire affordable health care, affordable health insurance.
Great, that's great information. Now, I know that's great, but how does one get access to this resource?
So this resource is accessible to people through the marketplace, the Federal Exchange Marketplace. It's there for everyone. Unfortunately, it can be a complex situation to navigate and to understand. As with many codes, insurance codes, different, just whatever, a lot of times things are so much information is embedded in writing and so much coding and the verbiage to where we kind of lose Main Street citizens and members of our communities lose understanding or connect with whatever is going on. And so, yes, it is available for you to go through the federal marketplace based on your state. Georgia is still on the federal market exchange. However, it is beneficial to find an agent who really understands the plans and can help you navigate to get the best plan possible for your family.
Right. Well, that's great stuff. So basically, and I'm putting up your contact information. So those who are on the show, those who on the show can actually see and be a part see your contact information
Thank you.
on the ticker. I'm getting a lot of messages. Oh my goodness. Everybody wants to be on the show. For some reason, we're having some technical difficulties with people connecting. I don't know what the problem is. So they're telling me that they're in the waiting room, but they're not able to see the show. and I'm not sure why, but we'll go forward as I text my engineer so he can work on it on the back end. Okay? They can
So
always go back and look at the show. I know your time is valuable, so I won't hold you up. Okay?
it's okay. I'm fine.
Okay. So, how do you use the healthcare insurance market to provide services to your client?
So I use the healthcare market to provide services to my client by actually, usually I will meet with them one on one or we'll do it over the phone. Tonight, case in point, we are at a mosque in our community that asks us to come and make sure that their members are insured. And so what I do is I could go out there and me and a couple of agents and we set up our tent and they come in and we go to the platform, ask some questions, get the demographics information, the household size, the household income, and talk about what is affordable for insurance. What does that look like for them? Because it's very much a case by case situation. And so we ask them what can they afford and what kind of coverage they're looking for, especially what is the quality of the health, because that matters a lot. If we have somebody who has to see the doctor a lot and has to, see many visits, we definitely want to make sure we're putting them in a plan that will be allowing them to see the doctor as often as they do. If we're speaking to younger people who need to go and get their preventative care, may not have a lot of need for the doctor, they were able then to help them understand the plan that we put them in and let them know this is what will be working for you. This is what your income can handle. So we do that all the time. We make sure we're helping our clients, our community members, have access to health insurance that is affordable. They can acquire health insurance, eat, live, and have a home.
Very good, very good, very good, very good. So, what population of our community do you serve? Do you and your capable staff serve?
Thank you. I appreciate that. I like that we're capable, right? Thank you for that. So we actually serve our low income communities. We have clients, we have business clients as well. So we go into businesses and we help them create a space where their employees and themselves are insured. But our heart and our passion is with our low income communities, especially our low income diaspora communities. So we do work in the low income communities as a whole, but we understand how limited information is, right, for the low income communities, underserved communities, is that much greater, lower for our diaspora low income communities. So we make sure we come to them, we educate them, make sure they understand and they have access to healthcare.
Very good, very good, very good. So let me ask you a question. What age group of people can use the ACA or federal marketplace?
So ACA can be used by individuals 18 to 64, individuals who are 18 to 64 and working. So the ACA, I would say there is Medicaid, which is like state funded programs, and it's for people with extremely low income. The ACA is for the guy who has some income but still cannot afford the high cost of healthcare. And so
Right.
right. So he's working. We know our retirement age is 65. So he works up until 64, from 18 to 64. He can take advantage of the ACA platform, the affordable care. Additionally, if parents have children who are in college up to age 26, they can be a part of their parents' ACA accounts as well. So say, for instance, there's a household of four and there's an income of 40,000. That family will be eligible to enroll in a health plan on the marketplace. Their 26-year-old, 23-year-old child who's in college and is not working because they're a full-time student can also have access to health care, health insurance through their parents' policy on the affordable healthcare platform.
Very, very, very informative information. Very good. So let me ask you another question. What is the difference between ACA and employee group insurance? What's the
So,
difference of the two?
so the employer group insurance is where the company purchases group insurance. So the small business owner will have to purchase a group insurance from a carrier, Kaiser, Cigna, whoever. It is a pretty penny. It's pricey. And so that is the reason why you find a lot of small businesses not offering insurance, because it's a very expensive piece. Now, what I found myself doing for my small business owners is coming in and speaking to them. You want to know what their pain points are. A lot of them do care for their employees. They want to make sure that their employees are healthy. Unfortunately, the money's not there to acquire these small group plans. So what I do is bring the entire team, the owner and the employees, over to the federal marketplace where they can use a tax subsidiary to be able to acquire affordable health insurance. So that is the difference. The employer purchase piece is that employer has to go out to a carrier and purchase it to pay X amount of thousands of dollars, excuse me, a month or year, or however it works. And then the Obamacare, the employer does not have to carry their burden, but because they're working, the employer and their employees, they have access to use their tax credit to get their insurance at affordable rates.
Great information. So that leads to my next questions. Are there setback for immigration status requirement for a person to use the federal marketplace?
Yes. So you have to be a legal citizen in the country. You don't have to have a green card, but if you have at least your social security or work permit, yes, you have to be legally able to work. So some sort of legal immigration status that allows you to work. Because remember, everything on the ACA platform, Obamacare, is directly tied to your work. That's why, in order to be able to access the resources on the platform, you have to be able to have some sort of an income.
Okay, good. That's great. So you have to have well, I don't want to summarize yet, but you're saying that immigrants can participate in the Affordable Health Care Act as long as they're legal in the country. They have some sort of status, whether it's just working status, a permit to work, because it is an income-based program.
It
Yeah,
is.
it is an income-based program. I
Mhm.
love it, love it, love it, love it. I need more people to hear this. They feel that because they're not a U.S. citizen, they cannot participate in such a program.
They can. They can. As long as they have legal status in the country to be able to work, they can definitely utilize the Obamacare platform. Yes, sir.
Okay, great information. Um, can people who are unemployed receive insurance coverage through the marketplace if they're unemployed?
Under some circumstances. So if you were working and you recently lost insurance, yes, you are able to go to the marketplace and under special enrollments enroll for into the Obamacare until you become gainfully employed again. However, it is not for people who are not working, because you have to be able to. It's a is attached the credits that you're getting. So it's almost like an earned income credit that you get at the end of the year as parents get. But this one, you get it up front before the end of the year. So it goes ahead and it offsets um, the high cost of healthcare. So it's not taking away the high cost of healthcare, because healthcare providers still have their costs, and they're going to keep their costs. The system, whatever healthcare rates are in America, they're going to be like that. However, the tax subsidy helps you to ease off the pain. So you have to be working, because that's like a tax credit that you get for that. So yes, it's attached to your employment. And so if
Great.
you are working and you lost a job, by all means, you need to be covered. Definitely contact me, contact somebody, an agent in your area, or yeah, let's get on the Obamacare, and let's on the platform, and let's gain some coverage. We don't want to ever be without insurance. It's so important to have our insurance continuous.
And I'm a true believer of that. After recovering from 4 heart attacks, believe me, if I didn't have insurance, one bill was over $200,000, and
Wow.
I know what these medical costs can be. So believe me, I'm a true believer of having health insurance. I go without it. I never go without it. Um, the next thing I want to ask you is a very technical question.
Go ahead.
Okay. What is the qualifying income for a person or a family to participate in the marketplace?
So this year you have to be 150% at the federal poverty rate to at least be eligible for it. And this year, I from looking at it more and more, at least an income of $15,000. So that's putting you anywhere at about maybe $1,200 a month, $1,300, $1,300 a month. Last year was a little bit lower, but of course, inflation is all everywhere, so some of the prices has affected that as well. But yeah, it's minimal, very minimal income requirements.
Very minimal income
Very.
requirement. So basically, it's income driven. So the lowest income person can qualify,
Yes.
can get affordable health care, can get decent health care. Now, when you talk about health care, the question is, when you talk about health care, you're talking about just seeing the doctor or seeing the doctor plus prescription.
You're saying it's totally healthcare. So it is first of all, it covers your preventative care 100%, right? When you go for your physical, your annual physical, that's 100%. And then we're talking about seeing a doctor. We're talking about it has a mental health component. It has the pharmacy component in there. Only thing that's not attached to that is your dental and vision. Everything else about your health is the hospitalization, the ambulance, the blood work. All of those things are embedded within the plans.
So you said some key stuff there that I love, and we in our communities we find that we shy away from. You're saying that we can call the ambulance, so we don't have to worry about a big bill if we have a complaint that needs to be assessed on an emergency basis. We
Yes.
can call. We can call. So no longer call a taxi to take us to the hospital where we lose valuable time and care. We can, call the ambulance once we're covered by the Affordable Act.
Yes. And to top that off, what makes it that much more attractive. There are a lot of plans that have zero premiums and zero deductibles. So pretty much it's free. The lower your income, the chances of those quotes coming back for zero are awesome. I just did somebody a couple of minutes ago. Her monthly premium was 92 cents. And the deductible, there's no deductible. This was a Kaiser. So it's very doable. You just have to have someone who's knowledgeable, who understands it, and come to the table with an open mind. It's very doable. Last year I did almost over half of what the work I did during the season was for zero deductibles and zero premiums. So yes.
Great, great. So that brings me to the next thing. Is it free money? Is it free money that the government gives eligible individuals to acquire health insurance? Or at some point, I hit the lotto, do I have to pay back all this money for the past 20 years that I was on the Affordable Act? Or is it free money? As long as I qualify this year and I qualify next year, that's it, it's done.
That is correct. So there is no retro payments in the sense that if you have had Affordable Care Act or had insurance through that for maybe 5 years, and then you hit the lotto, now they want all the money back. That's not the case at all. So the case is that you are getting a particular amount of tax credit for that year based on the income that you have submitted. So say for instance, you're a single person and you're at $15,000. The tax credit, that's coming back this year, I'm looking at more than anything is about $361 a month in tax credit, right? So what happens to that 361? You get an upfront credit on your insurance bill. So if you were looking for a particular insurance, and we already talked about your health and the need for, you know, the doctors as often, or the frequency of your need for the doctor and everything, we will go onto the platform and we will quote for you. I always like to look at the silver plans because they're awesome. They have everything you need. They're mealy. So if you are pretty healthy or need some doctor, not as much, no extra critical stuff, the silver works perfectly for you, right? So we go into the silver plan. You are maybe at 15,000, and you have a tax credit monthly of 362. You're looking at paying anywhere between $0 to maybe $3 or $4 a month. And that's based on the carrier.
Wow.
Right. That's based on the carrier. That's based on the star rating of the product and everything of the plan. So it's very affordable. And so if you report 15,000 on this application and you file your taxes and you're at 15,000, the credit that you got all year is free. You don't pay anything back. However, if you reported 15,000 on your application and came back with 25 and 30,000, you will be paying back something. I don't know. I don't have the table for how that is done, but you will be paying back something because you reported a lot less than you actually earned.
Right.
Mhm.
Right. No, of
Or
course.
what you could do, you could be earning 15,000 this right now, and then come May or June, middle of the year, you increase your money increase. Call me back, call your agent back, and say, "Hey, I got a new job and I had an increase," and we'll just change it. And then the system would adjust the tax credit accordingly. That way, you avoid any, you know, hitting fees because you not hitting fees, but any penalties because you did not do the right thing by reporting the increase in the income.
Great. That's great. Great information. So, um, can anyone go to the marketplace and sign up for insurance?
Yes, it is an open federal marketplace. Yes, you go into your state. If your state is on the federal exchange, like Georgia is this year, go ahead and do it. If your state is not on the federal exchange, you should be able to know what the website is for your state, and mostly probably the state name dot something, right? And then you get on there and you can apply. Georgia was supposed to be off the marketplace this year. We learned that they didn't get approved by the federal government. But from what we saw on what was supposed to happen, had Georgia been off the exchange, it was very similar to what the federal exchange has. It mirrored it very similarly.
Great, great, great. So,
So anyone can, but I would suggest that someone get you a knowledgeable broker agent to go onto the platform. I've heard
the only knowledgeable agent that they're hearing is you. So,
oh well, yes. I'm available. Call me.
And that's why I invite you to our show tonight, because I know you do a great job, and you've been working with the community, and I heard a lot of great feedback about you, and you know, I had no other pleasure, even though I haven't met you in the flesh, to have you as part of the show to educate our communities, because there's a number of offers out there. People are making poor decisions out there on healthcare. This is the time when you know, it's open enrollment where we enrolled for our 2024 fiscal year for medical, and you know, there's all kind of offers out there. I heard one tonight blow my socks off, where they said that the agent offered them some shopping cart to go shopping to sign up with them. Okay, so there's a number of things out there that people are doing that I think is unconventional. And this particular person that said it to me, and I'm no way a health agent, but what the person is saying to me and describing to me, I don't think it's ethical. And there's no place for that in our business. So the industry is fully regulated by the federal government, the way I understand it. Yes, you have federal and state government regulations, but there's still the uncouth people out there in the industry that does what they want to do. Um, for our listening audience, you guys all know how to get to me, 855-411-0424, and directly to Miss Cynthia, 404-604-0734. You give her a call, report to our show, the EHB Services Let's Learn Money show. And she'll work very vigorously to get you covered, you and your family covered, and your loved ones. Miss Cynthia, we're 35 minutes into the show. I'm gonna forego some commercial tonight because we had some technical difficulties. Because I know your time is valuable also, and I need the information to get out there. So we did talk about the Affordable Healthcare Act, the Obamacare. I mean, I love it.
I do too.
And there's so many people that are being covered by it. I mean, I had a trip today to the cardiologist, and it was a very pleasurable one because when your copay is only $5 to see
Yeah.
a cardiologist,
Exactly.
you know what I mean? You're not paying $100 and $200
I
to
know.
see the doctor, and then he go on the order test, and that's an additional fee.
Right.
It's all covered by that $5 between the doctor and the insurance company. They figure the rest out.
Right.
So it's great. I mean, in 2020, September 20, 2020, when I had a heart attack, I was right in my last heart attack. I was right in the emergency room. Don't ask me what the bill is. I don't know, don't care, don't want to know.
Right.
Health insurance took care of it. I don't even know if I had a deductible because I didn't pay none. I think I met my deductible.
Exactly.
So it's beautiful. I think it's the best thing that happened to us as a nation.
Yes.
The Obamacare Act. I know that there's some of our friends on the other side that doesn't care for it. They try to have it repealed. I'm so happy that that wasn't successful. And there's so much people that are able to benefit from it that I'm very happy that it's there, and we don't have to go to church and hear sister this or brother that don't have health care, but they need medication. There was one time in this country, the burden of health care was on the citizens that visited the charitable organizations. So, you went to the house of the Lord for a little bit of prayers and based on your faith, but then you have to hear about, your neighbor, your friend, or your family that need help.
Right.
Equally so, I tell people that's why I tell them to have life insurance, because we don't have to take out the hat anymore. We all can have life insurance. It's very reasonable and
Very
affordable. Very affordable. There's so many different choices for life insurance, from a savings plan. If they want to save money, if they want to build up a number of cash, they want to have milestone events in their lives, they'll be able to do that. So doing that is very, very important, that they have that to do.
Right.
So, we as a people, we must be able to show our community what we're able to do, what we can do for them, and how we can help them, and that we're reachable, we're a resource to them in these financial areas. It's not what you make, it's what you save. Okay? And there's a number of people out there that spend a lot of money for healthcare, and a lot of money to put away their loved ones in a time of loss.
Right.
But if they put a little bit of money away every month as a commitment, those burden wouldn't be there. I hate GoFundMe pages. I hate GoFundMe pages, and I don't contribute. And I tell everyone in my family and my friends, listen, if you want to know about finances, see me. If I can't do it, I can point you in a direction to get it covered. We have to take care of ourselves and stop being dependent on other people.
I agree.
that, I'm very, very happy. I want to take the next segment in. We're 9 minutes into the next segment, so I'm going to beg your due indulgence. I might go a little fast on it, but I want us to get an hour of down pack information into the community. If they have any further questions, they can reach out to you on 404-604-0734. Your name is Cynthia Logan. It's placed all over your screen. For those of you who look at us through social media, I love it. I love the broadcast. I'm very excited about the information that you're sharing. I didn't know half of it because I don't play in the health market. But I have resources like you that I can call on and get my friends and family, even myself, covered if a need arrive. I know this is a time of year where everyone has to start looking to make sure they're on the right plan. It's doing what it needs to do for them, and they're getting the right coverage. People think that because they have health coverage, they're covered. I say you're not, and I'm sure you'll endorse that because that changes from year to year.
It does.
Yeah, you might be in love with your doctor, your primary care physician, but your primary care physician may no longer participate in that plan.
Right.
Yeah, and your next annual, which a lot of people in our community don't do. They don't do annual checkups. Me, I do quarterly checkup. I'm sorry.
Amen. Good.
I do quarterly checkup. My doctors love me. I come in. I said, please check out the old taker. Just give me a clean bill of health so I can keep going. See you in 4. You know what I mean? So, I stay on top of my health very regularly. I think that more people need to stay on top of their health. And since we have the Affordable Care Act, for those people that between age 18 to 64, that you say that are working between age 18 to 64, I think they should and must have health care because it's affordable.
Right.
I mean, you made an example, regardless of how much you're making, it can be as low as cents, 90 something cents, all the way up to wherever it falls. And I think that everyone should participate in that. I thank you for that information.
You're welcome.
Now, we have to go to the other side of the spectrum. The other side of the spectrum is the side that I love but hate, because it seems like I'm getting there.
It's okay.
Medicare and Medicaid.
Right.
Yes. I would like you to tell our listening audience, what's the difference between Medicare and ACA?
So Medicare is, I guess we answered that too, but let me do it again. So Medicare is the insurance that is available to our retiring age, right? So now the retirement age is 65. So 65 years and over is Medicare. And then Medicaid, Obamacare is what we talked about, 64 and below, working with minimal income, right? So in order to be qualified for Medicare, you have to be 65 or you have to be diagnosed with a disease, maybe an end-stage renal disease, and deemed disabled by Social Security. So that's the two way you can get it, either at 65 retiring or you have a disability. So that could happen before you're 65.
Okay. So you don't have to be 65 only. You can be disabled.
Right.
And get Medicare.
Yes, Medicare. You said it right. Awesome. You're very smart.
Medicare.
Yes.
All right. I'm listening. I'm listening. I'm
said
listening.
It right.
Good. So now, key. Not only 65-year-old get Medicare. If you become disabled, you qualify for Medicare.
Right. And so that disability can be in the form of a disease. It could be in the form of a physical disability. It could be formed in the form of a mental disability. So the spectrum of disableness is pretty vast, right? You just have to be, you have to, okay, case in point, I used to teach before. And so my students would, some of them who were special ed, when I used that end of my certificate, they were eligible for Social Security as well, right? So now would they get Social Security, so they are able to get a check, and they get, they can be qualified for Medicare, yes. So if you don't have to have a car accident or something catastrophic that cuts your leg or cuts your head. If you have some sort of a kidney disease that's going on, that can also be based on your doctor findings and the level of impact of the disease. You can apply to Social Security, and then if you are deemed disabled, if you are awarded that disabled piece, you'll be able to go on to Medicare.
Great.
Mm-hmm.
Great. So now I'm gonna move it right along on this one. Thanks for the explanation. We really appreciate it. I like it that our listening audience, yeah, young and advanced in age. I don't like to say old.
Right. Mature,
Understand
I say
that
mature. Yeah.
that's right. I don't get in trouble for my words. I pick them wisely. So the our family and foe, friends and associates now understand that if they are qualified under the Social Security rule. Now, I'm going to stop you right there because there's a very important issue that I'd like to bring up right there. Please, if you would indulge me.
Yeah.
Okay. And that is a lot of people come to the United States of America for many different reasons under different circumstances. What they do not do, when they have a change of status from a work permit to a green card, from a green card to a citizenship, they don't update Social Security. And a lot of people don't understand that there's a big need for that. Also, equally so, many people in this country don't understand that you don't have to get your neck cut off to be disabled,
Right.
to be deemed disabled. And all it takes is to go online, get the forms, fill it out, have your doctors get the report from the doctor. It's nothing worth trying
Right.
and filing it. And that's very important. That's big. I love it.
It is.
That's important.
People don't know that. They think they have to be handicapped, physically handicapped, to be able to be considered disabled, but no, you don't. So if you have a situation going on, if it's a health, something that we don't see, you don't wear on your outside, whatever the case may be, but you've been treated for it, you go ahead and you apply for Social Security. As Eugene said, Social Security is not going to just up and give it to you, the disability status, but they're going to use your doctor's evaluation as well. And so if you have been going to your doctor and he has been the one that came up with the diagnosis and the severity of it, then by all means, it is worth a shot of going ahead and applying for Social Security, because it could very much well maybe limit the amount of hours you can work, limit the kind of work that you can do, and limit what how much you care for yourself independently. So you definitely want to make sure that you are getting classified and getting the benefits that are available for whatever the situation is.
Right. Super. Now, the next question I have to ask you, this one bothers me for more reasons than one. What happens if a person does not earn 40 quarters of work to receive Medicare Part A?
Right. So that part of the question bothers me as well. I don't like that part of the question either. And I think I don't like it. It bothers the both of us because we're immigrants, right? And
That's
sometimes
right.
and sometimes we were fortunate enough to grow up in America, right? But then sometimes our parents who brought us to America to escape whatever situations or for the opportunity that awaits us here, they come and they are a little bit older and not able to get those 40 quarter hours, which is really 10 years of work minimum, right? So when you're
Right.
working and you get your paycheck and it say FICA, 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 FICA all the time. Or some checks will say Social Security tax, but usually it's that FICA. Most of it is that money that is coming out of your check and is playing into that Social Security for you. So if you have 40 quarter qualifying quarters of work, which is usually about 10 years, then you have access to Part A. If you don't have that, they will not give it to you. They will not. I'm working with a client right now who it's really sad. They moved from Syria and the father worked he had 38 quarters. He didn't have the last two. And so he passed away and the wife um doesn't get Social Security. She has Part B, she pays the premium, but she doesn't have Part A. And so, she
What
got
is
medic.
part A?
Okay, so good question. I'm sorry. So Part A, so Medicare is in two folds, right? The part on your check that says FICA is the part for the hospital. So it cover your hospital when you're in the hospital, when you are hospitalized, when you're at a facility, and those kinds of things. That covers that. But every senior is not in the hospital all the time, right? Seniors have active lives. A lot of them are active and they need to go for preventative care. So that Part A does not cover preventative care, which is your your routine doctor visits, which is your if you needed some sort of equipment to help you get along at home and those kinds of things. Part A doesn't do that. So you have to get Part B. Part B is the piece that does that. Now, Part B comes with a premium. So that premium is deducted monthly from your Social Security if you do get Social Security. Now, in this family I talked about from Syria, father passed away. Usually, if a spouse passed away, the living spouse inherits the deceased spouse's benefits for Social Security. She had nothing to inherit because he had only 38 qualifying quarters and not 40. So she's now left. She has Part B. You can go ahead and purchase by Part B, and she has to pay that premium out of her pocket, 160 something. She gets Medicaid, but it's like whoa. And so my heart was really broken for that family, particularly because I felt like they were so close at 38 quarters out of 40 quarters. Come on, right? It was death. He passed away. But unfortunately, the laws are the laws. I mean, we get a glorious opportunity coming to America from our different countries. However, they have stipulations and they have laws, right? And unfortunately, they fell on the other side of the spectrum where that law was concerned. So
Right.
there's a Part
Well,
A and there's a Part B. And then there's Medicare Advantage that everybody calls Part C.
right. Right. That's exactly where I'm going. So if you want, you can lead on that. Because that's
Yes, I
exactly
would.
where I'm going. Because
Okay, so
I want to go C and D.
okay. So if you have regular Medicare, say for instance, when you turn 65 years old, 3 months before you turn 65, and the month of 65 and 3 months after, usually the 3 months, maybe I would say 2 or 3 months leading up to the first 3 months of the 7 months that you have that window, you start to get all these calls, you start to get all these different paper from Social Security and everything, and then you get your red, white, and blue card. And that red, white, and blue card is your Medicare, regular Medicare. So that's just the United States Medicare, right? That's Part A and Part B. Okay. So now we know that Part A is going to take care of you if you're hospitalized, if you're in a hospital, da da da. We know that. We know Part B takes care of your preventative care. But Part D is your prescription drug. Part D is not into any one of those things we talked about. We also know that Part A has already been paid for during the hours of work, the years of work, because you paid every time it's a FICA. Part B, you are now paying a premium. This year, the premium was $164.90, I believe, and it's going to go up, I think, about $11 coming 2024. However, you will have to go, if you just keep that regular Medicare, you will have to go and purchase a Part D, a prescription drug plan. All right. So now here comes Part C, right? We talked about A, B, and D. So A and B, regular Medicare, then you have to buy a prescription drug plan. So now you're paying the B premium and you're paying your prescription drug premium. That's a lot of money. And if you go to the hospital, you will have to pay your benefit period deductibles, which is $1,600 per benefit period. So, but if you go ahead and you get Part C, which is the same as Medicare Advantage, what the government did, they contracted with carriers to help them provide the Medicare benefits to the constituents. Now, the regulations there is that they cannot provide anything in their packages that are less than what the government gives, right? So it has to be enhanced. It can't be less. You cannot say, oh, you won't give them this and you won't give them everything that's in the regular Medicare. They have to have in the Medicare Part C. In order to be able to participate in Medicare Part C, you have to have Part A and Part B, right? So if you have Part A and Part B, you come into C. Most of those Medicare Advantage plans have prescription drugs attached to it. So that eliminates that prescription drug premium, right? Additionally, it has ancillary products. So it has like your services, it has your dental, your eye, your vision, it has those things. And then the card also, sometimes they will have the well care visits where you have an in-home visit or a card. This year, a lot of the plans, not just this year, but a lot of the plans have cards where they're giving you money on like a debit card, a credit card, monthly, $100 to $150 to about $190, $200 or so, where seniors are able to use it for groceries. They're able to use it for pet stuff. They're able to use it over the counter drugs, just some extra money in their pockets, right? So those are things that are embedded in Part C, the Medicare Advantage, that you don't get if you were just regular Medicare. If you were regular Medicare, Part A would pay for the hospitalization and those in institutionalized services. Part B would pay for your maintenance, your preventative care, and those kinds of things. And then you have to go buy a prescription drug plan. Part C takes away usually the purchase of the prescription drug plan because it's usually embedded in there, right? And then it gives you the vision, the dental, the hearing, gives you all of those things. And additionally, the low cards, extra money. Then it gives them, I know a lot of the carriers have like the silver strip where it gives them a membership to gyms and stuff like that for them to go work out. So it's a lot of other benefits that you get coming under the Medicare Advantage that you normally will not get if you just had the regular Medicare A and B.
Great. That's a mouthful.
Mm-hmm.
That's great. Everyone can go back and listen to the video. It's going to be up on all my social media. That is beautiful. That
Thank
is
you.
beautiful. So, I have a question from someone that asked me, what do you mean by carrier? So, the carrier, to answer your question, the carrier is an insurance company.
Right.
The provider is the carrier.
Mm-hmm.
The little that I understand from what
It,
you're saying,
it is.
the carrier is the insurance company.
It is.
And I have another question here where someone is asking, can someone receive an employee pension still and participate in Medicare?
Yes. So you can, and sometimes it's a decision to be made because you can have if your employer pension is paying for it based on how much money you're getting, right? So the basic amount is that 164.90, and that's usually, or there's a scale amount for the salary. I believe it's under 70,000 or something like that, where your income is annually, and you pay that 164.90. If you're getting pension and you are also getting your Social Security because you're 65, right? And then you're getting whatever else you had. Some people had low extra monies and stuff like that. You can get Social Security, but the amount that you would get may be lower. But still, you'll be able to get either your Part A and something else. Now, what we have found, and I stay very clear of, is those federal pensions and those the federal, the state, because those pensions are really good, right? Sometimes it's just not the money. They had such an awesome benefit packet. I don't want to mess with that, right? Because when I work with my clients, I'm not working with my clients based on what I think is right. I'm advocating for them. I'm educating them so they can advocate for themselves. And in as much as putting them on a plan or helping them find a plan or something may be good for them and beneficial for me financially, I rather be honest, upfront, transparent, and do the work to benefit my client, to meet their needs. So when I come up with those federal plans and those state retirements, and we're looking at it, and they had this, and I tell them, you're better off here. Because the problem with that, if you take them off of those plans, they cannot go back on them.
Right.
They cannot.
Right. It's a
So
one-way street. Once they're on it, they're on it. The ones
right,
off, they can't go back on.
They
Oh
cannot.
yeah, I clearly understand that. That is good. That is good. That is good information. That is good information.
That
So
is the reason why.
those people who are on federal plans, federal employees on federal plans, it's a one-way street. As long as you're on, you're on. If you come off, you can't go back on.
You cannot go back on. So that's why I stay clear of it, because most of the times those plans are rich. They were developed, they were rich, they had everything in it. The postal plans and those things, I stay clear of it, right? Because I don't want to have the conversation to make anybody misunderstand me or even have to debate with such a good health packet, right? So Medicare Advantage is great. We have all these awesome things that go on in there. And I will tell somebody, if you have a pension, a good pension like that, and you want some additional benefits or something, then buy a Medicare supplement plan, right?
Lovely. Right. So there's a Medicare supplement plan that can subsidize anything they need without giving up.
Yes.
Yes, I hope Radio Line is out there. They're paying attention. I know we're going into a little bit of overtime here, and I thank you for that information. I think that's valuable information. There is a supplement available, so you can supplement your current position to a better position or a different position based on where you are and need to be.
Right. You can increase the benefits that you can receive. You can get all of that. So just get a Met sub and you'll be fine. Yes. That's why I tell my clients. Yes.
And they can call you and you can advise them and help them. Yeah. So remember, Miss Logan's phone number is 404-604-0734. Regardless of where you are, you can give her a call, and she have an agent in her office that can help her, that can help you in wherever you're calling from. There are different requirements and qualifications in different states. Yeah. So as a broker, she has a number of agents working for her that understand your specific states and the requirement for your specific states that meet your needs. So yes, I would advise you all to give her a call at 404-604-0734, or give me a call if you can't find her number. You can always give me a call, book an appointment with me, and I can always bring her on the appointment to meet with you and get her to give you advice. She is my healthcare right-hand person. Everyone I know, I refer to her. I encourage you to engage with her going forward on all your healthcare needs, whether it's Medicare or Obamacare or a supplemental Medicare Advantage, Plan A, B, C, D, whatever your healthcare concerns are. Whatever your healthcare concerns are, I would say to you without any reservation, you heard it from me first, hold me hostage for it, contact Ms. Logan, and she will be able to assist you. Before we wrap it up, I want to ask you one last hard question.
Please do.
And that question is nearest and dearest to my heart. Nearest and dearest to my heart. The question that I have is exactly what are the various components of Medicare?
So the Medicare, those are the different components we just talked about, the A, B, C, and D, right? So we got the A, our hospitalization. We got the B, the preventative, help you get along better at the house, can get an aid at the house, can get you medical equipment that increases mobility or the quality of life that you live. Then we have the D, the drugs that will help you sustain a healthier life. So that's part A, B, and C. And then we have the comprehensive piece, which is the Medicare Advantage. So it brings all of that together. It takes care of you. That it adds your exercise to it. It adds your dental, vision, hearing, and your little social club membership and those kinds of things. You can have your silver sneakers where they have gyms all over the place. I mean, like really good gyms too, not just mom and pops. They have the LA Fitness and all that good stuff. And they can join all of those things and then have an active life. So those are the components of that whole Medicare Advantage piece. Well, the Medicare and Advantage, but Advantage is the comprehensive piece. So it's almost like a really nice decadent red velvet cake on the table, and then you just icing it really good. So yeah, it's amazing. And I love to see most times too with low earners in the Medicare Advantage space, a lot of times everything for them is this. I don't like to say it costs them zero because it costs somebody something, but for them, they don't have to pay anything. And
Right.
I
they
work
don't have
in
to
that
out of pocket anything.
Right. They don't bring anything out of their pockets. I work in that population as well. And it's called, DSNP or double eligible. So I come to my clients, a lot of them don't know that their income is low. They know it's low because they can't get them along, but they don't know that they could apply for extra help. They also don't know that they can apply for Medicaid. And so
that is the reason why I asked the question. You're
yes,
getting to me because a
yes,
lot of people don't know that they can apply for extra help.
they don't.
Based
They don't
on
know.
their income, more resources are
Yes.
available to them. I agree.
So what I found out today, there's a penalty for Medicare when you're eligible for Medicare Advantage and you don't apply for Medicare Advantage and you don't have you don't have a what's the term we use, you don't have a credible coverage, right? So you don't have insurance through your job, you don't have anything, you're eligible for Medicare Advantage, but you remained on Medicaid, the Medicare A and B, just a regular Medicare. And previously, if you did that up to a year, you would be and try to come onto Medicare Advantage, you would be penalized. So I have clients who have heard so much about Part C, which is Medicare Advantage, but they can't move because of that penalty. So today, I made it my business to ask this question over and over, and I found out that if they apply for extra help and they are approved, I don't care how many years ago the penalty is gone. It's gone. So I reached out before I came to this event, and this is a packed house at this Mox tonight. It's a packed house. But I reached out to about 4 or 5 of my community, my clients, prospects, and they said I would do it. I just don't know if I want to pay that penalty because it could be taking all, more money out of my Social Security, whatever. And they were so happy to learn that, no, we're going to apply for extra help. And if we are approved for extra help, we don't have to pay any penalties. So, yes.
Great. Well, again, out there in Radio Land, for those who look at this webinar, Miss Cynthia Logan is a resource to you in your community, in the community. Please reach out to her. Please don't be shy. Now we don't have to worry about paying by the minute to call long distance. There's no such thing. Everything is within range. 404-604-0734. Give her a call. If you can't get in touch with her, you can always give me a call, and I can call her to board. You can go on ehbservice.com website and book an appointment, and I can get her engaged to meet with you and help you out. At this
Yes.
time, I want to say thank you, Miss Logan. I appreciate your help. I know I begged you for an hour of your time, and we are on overtime. Sorry for the difficulty connecting earlier, but these things happen. You shared some real good information. My viewing audience, my clients, my friends, they're all here listening to you, getting this good information, and I'm sure they'll be reaching out to you. So without further ado, I'll let you go back to your
event,
and we'll be in touch. No problem.
All right.
And I look forward to having you again in the studios at another time, and you can give us some more insight to your lovely knowledge base on the healthcare industry in the United States of America.
You're welcome, and it was a pleasure to be here. Thank you so much. And as Eugene said, I am available to help you in any which way, any capacity. And be on the watch out because the Palava Hut is coming to your state as well. So we're building a network of agents, of knowledgeable, capable, resourceful agents in every state to make sure we're taking care of our communities. Yes.
Very good. Thank you very much, and have a good night.
You as well. Good night. Bye-bye, everyone.
Bye-bye.
EHB Services, LLC, for all of your financial needs. We are a licensed brokerage with years of experience in the financial industry. Let's discuss your financial DNA. Saving for college, planning for your retirement, preparing for milestone birthdays, and significant investments such as house, car, or boat. Call Gene at 855-411-0424. You can also follow him